So as you can see, we're coming to the final part of our program where we're going to bring this down to the community level and begin the community discussion phase. There were several key words that we constantly talked about as we were putting this program together: educate, inform, engage, and act. Well, this is the portion of the program where we begin that action. How do we create the roadmap to end hunger? So, a few tech problems today, and we were going to be showing a few clips from A Place at the Table, which dealt with school breakfast, SNAP participation, and charity is not enough. So I have to riff for just a little bit and see if we can't get the people back there that are going to be on this panel mic'd. Now would be a perfect time to hit your hashtag Soul of Hunger and to put a comment onto the live streaming of this event. Additionally, I don't want to preach to the choir. I know that many of you out there in the audience are those that work day in and day out trying to end hunger in New Jersey or throughout the country. But there are a few things that I think that we can do and that we need to think about. Outreach and education are powerful tools. Local data does matter for decision makers. So when you do studies and you have statistics, I encourage you to please share them. Programs can be a catalyst to improve current circumstances. Another program, as the governor mentioned, is trying to increase the eligible children's participation in school breakfast. I think that's something that many of our organizations, through the contacts we have in the community, can do. The breakfast after the bell approach, as Tom said, is a very effective tool. Hunger does, and it has been shown that hunger does put children at a deficit academically. Studies have tied food insecurity to iron deficiencies, which interfere with development of basic motor and social skills. So it all shows the importance of school breakfast before we present our children with materials to learn. Another thing that I would like to encourage us all to do is to think about what collaborations or partnerships we might have witnessed in our work that has helped move the needle. And let's talk about it and share those experiences. I think I heard the governor mention the virtual supermarket, which is going to be starting in Camden. In Camden, New Jersey, their last supermarket moved out, and the next one does not come in until January of 2015. In the meantime, there will be, through the social services, the ability of the people being served to get their fresh groceries in a virtual manner through their social workers. So we encourage the sharing of things like that. Or the nonprofit grocery store, which is going to be starting up in Chester, Pennsylvania. So I just got the word. I've riffed along enough. So I can now invite a distinguished panel of individuals from across the country coming together with New Jerseyans. And at this point, I'm going to turn the conversation back to our moderator, as each of the panelists will give a short 60 to 90-second self-introduction. Thank you very much.
playing Willie Geist now, aren't I? 1, 2. Are we on? Okay. There were 3 things that we wanted to cover in this panel. It was SNAP, school lunch, and then the idea of charity's role in fixing, or whether it can fix, hunger. And I think it's kind of broad, so we can weave that discussion in, but I'm going to just throw something out there to start this. If we all agree that charity can't end hunger, it isn't ending hunger. We've never had more of an outpouring in this country when it comes to charity, so it's not fixing the problem. What can we do? Not to again manage hunger, but to actually end hunger. So I just want to sort of delve into some of those things and see where where this conversation will go. We have a short time, so let's try to keep the answers short and keep the conversation lively. Carlos, as director of the Food Bank of Monmouth and Ocean Counties, what are you seeing? How has the clientele changed in recent years, and are food banks able to meet the demand?
Well, Tom, the clientele has definitely changed. Over the last 5 years, we had an increase of over 84% in the number of people that we're serving. We're currently serving 1 in 10 residents in Monmouth and Ocean County. And you're right, it's not just about the emergency food that we can put out, although as we heard earlier, it's important to take care of that immediate need. We see our job at the Food Bank of Monmouth County as twofold. 1, take care of the immediate need and feed the lines that are growing. But 2, shorten the line. And we have initiatives that really do both. Initiatives that greet the clients when they're at their neediest, but also work with them to connect them to important benefits like SNAP, tax credits, and so on, that'll really help them get on their feet.
Bob, Feeding America is nationally recognized leader in the hunger space. It's the portal by which most people actually engage in the hunger issue. What steps is Feeding America taking to sort of lead and guide a million of food bankers and volunteers and people who are donating into kind of political action? And what are you guys sort of doing as far as outreach and sort of let people understand that food banking isn't the only solution? I know on the website it says the government has a role. What are you doing to sort of further that message?
Yeah, Feeding America is a nationwide network of food banks. We distributed food to 37 million people last year, including 14 million children. And we serve every county in America. And so what that means is we have tremendous reach, right? And so we use that reach to help people find their voice and advocate around the issues that we're talking about in Washington. We've got a team based in Washington, D.C. that's focused on policy issues. And then we've got an advocacy network all across our food banking system. So 2 weeks ago when the Farm Bill debate was going on, 6,000 calls were made to Congress that day because advocates all across the country that are working as part of the Feeding America network work to make that happen. And so we're working hard to continue to build that grassroots effort across the country.
Ellen, FRAC has been a leader in sort of advocating against the SNAP cuts. I was actually in Rosa DeLaura's office with Ellen making calls to some of the members and talking to some people. What other initiatives are ahead that you see? What other sort of legislative issues do you see sort of coming down the road that we need to get involved in to help end this problem that we have?
Well, the one that you allude to, that House bill that would cut SNAP by $40 billion is the #1 thing that we see, and it could be looming for quite some time. It may be a while before Congress gets to deal with it, and so it may be something that we all have to worry about for the next year or so. But
if they take no action, it's probably better.
Yes, no action would be fine because no action would keep the benefits that people have. Unfortunately, and it was something that I think during the film, when people saw A Place at the Table earlier, they gasped a little bit about the idea that the child nutrition money came from food stamps. And unfortunately, here in New Jersey...
That was talking about school lunch here.
About school lunch, sorry, yes. In New Jersey and all across the country, as of November 1st, SNAP recipients' benefits will be cut because of something that was done in 2010. But that's the first time that cut will hit. Right,
let's talk about it. It's the ARRA boost. Let's talk about that. So the American Reinvestment and Recovery Act added how much money to SNAP?
A very significant amount of money to boost benefits so that not only would households have a more adequate allotment during the month, but that money could go into the economy and help communities rebounding from the recession. And unfortunately, when that's phased out, because of the decision Congress made a couple of years ago, A family of 3 on SNAP will lose $29 a
Right.
month. Not just November they'll lose $29, but each month
Every
going
month, right.
forward. So it's a serious cut and something that we're all going to need to educate the public about and educate Congress about why those kinds of decisions have such negative consequences.
Right, and $29 doesn't sound like a whole lot of money, except we all know that food stamps usually run out about 3/4 of the way through the month.
Yeah, I think for anyone who listened to the voices of hunger on the earlier panel, for anybody who saw a place at the table, for anybody who's done the food stamp challenge, as my colleague Bob did from Feeding America last week, they actually know what that amount of food is, and it is a difference between making it through the month and not.
You know, Ellen, the ERA cuts that you're talking about, they equate to 1.8 billion meals a year, right?
Right.
So that's happening November 1st. There's nothing, more for Congress to do on that. And then we're talking about an additional $40 billion in cuts over a year in cuts that would represent another 1.5 billion meals a year. And to your point, charities can't do it alone. We distributed about 3.2 billion meals across our system last year. We're really proud of that. But these cuts represent that much and more.
Right, but that's great that Feeding America and food pantries are able to distribute that much food. But in a way, it's almost like sort of judging a hospital by how much medicine they put out. And so, again, we need to change we're managing it. We're not sort of talking about how do we fix this. Richard, as a member of the business community, a leader in the business community, what do you see the sort of private sector, what is their role in sort of talk about some of the things that you're doing at ShopRite to help alleviate hunger? But again, how do we talked earlier and you have some ideas about how to actually end hunger. You want to talk about that?
Well, I don't know about how to end hunger,
Tom,
Tom,
we talked about this idea of it's a human resource issue.
Well, let me just say this. I'm in a pretty unique position in that I own and operate 30 ShopRite stores in Central Jersey. And we find ourselves kind of the marketplace, and we're at the epicenter of government regulation. We're the ones who serve the public. We redeem the food stamps, and we try to serve all of our customers in the best way we possibly can. And I think that when you look at some of the programs that we've initiated, you've got to look at it from a humanitarian side. We started a program called Partners in Caring. It was back in 1999 that we launched that program. And that program was pretty simple. We asked our vendor partners, Coke, Pepsi, all these different, maybe not so popular, depending, but we asked them to give a portion of their profits, and we would, the retailer, give a portion of our profits to Hunger. The main charity is Hunger. And since 1999, we've raised over $30 million that has gone to all the local food banks.
We talked about this earlier. How do you talk to your colleagues and say this is something that everyone should be doing? I mean, this idea of great, corporate citizenship. I mean, clearly you're doing that. When you sit around the table with other food retailers, do you tell them about the things that you're doing and try to get them to come along?
We have done that, and I think that it would help. And this is where maybe sometimes government comes in. And when we talk about this being a partnership between us and the people, the American people, government is takes the leadership role for the American people. And I would think that if there were some type of incentives for business to encourage them to do more of these types of humanitarian things, you'd see much better results.
Dr. Kuntz, as a in a medical profession, you know better than most about the healthcare outcomes of people who are suffering from food insecurity and the diseases associated with it. Can you speak of some of the long-term costs that are associated with to New Jersey for not addressing the root problem of hunger?
I can't speak to a particular number, Tom, but it's a devastating problem. More on the obesity side of the coin. So much of what we treat both acutely in the emergency department and our family health center and our clinics, as well as chronic conditions are related to obesity. And as we need to take costs out of the healthcare system, we've got to get our arms around it. And I do think there's more focus on it, whether it's the recognition of obesity as a disease, which is a separate debate we could have, but there's clearly more attention that needs to be paid. It's so demoralizing when somebody, whether they're obese or not, comes back to the emergency department because they had to make a choice between medication for themselves or their child.
Right.
And they're back over and over again.
Seniors taking medication on an empty stomach.
Or seniors
puts them
coming,
in the hospital.
or seniors coming in over the weekend with mild, kind of hard to figure out problems because they needed a place to eat for 3 days. That's what
So, Cecilia, you also see the long-term effects of that children in New Jersey are have because of hunger. What do you think, if you were talking to Governor Christie, what would you suggest to him that would have the greatest impact on children and sort of getting the nutrition that they need?
Okay, first of all, I'm Nancy Perello.
Nancy, I'm sorry.
And it's Advocates for Children of New Jersey.
Yeah, I'm sorry.
Just so we know.
someone.
No, I know, I'm filling in for my boss.
You're filling in. I'm sorry.
It's cool, it's fine. Okay. What is the most important thing? What would I ask Governor Christie to do?
So, yeah.
Being the most important thing? Wow. I don't think there's one answer.
Answer 3 different ways.
I think one of the most important things, which he is not in his power to do, but certainly he could help to change the conversation. We do a lot of work around school breakfast, and a lot of that work was really about changing the conversation and stop blaming parents because they didn't bring their kids to school early enough, and stop blaming, the kids because they're playing outside instead of coming in, and start having schools take responsibility for serving breakfast in a way that's effective in reaching those children, right? I think changing that conversation along all of these lines, we blame the victims. And, it's disheartening sometimes because, we have been able to generate a lot of press around the school breakfast issue. And you look at the comments and it's like, what's wrong with those parents? Why are we feeding those kids? Why aren't the parents? And you're talking about how to end, I think, and Governor Christie hit on it, it needs to become more personal. Like it's not us versus them. We're in this together.
Right. So, does everybody agree that we have a real messaging problem around hunger
Yeah.
and who's hungry and how to fix it? Does that seem to be the biggest problem?
I think it's a big problem. It's been the gist of our school breakfast campaign, and we've had a lot of success by changing that conversation.
Bob, I didn't mean to cut you off before. As far as, again, being the huge organization, always on the forefront of trying to deal with this issue, have you seen a change at all in sort of the way people are with your food bankers? Are they looking at a different approach to it? Are they realize that it's more than sort of the giving out of food? Do they understand that message as well?
Yeah, at Feeding America, I think Carlos articulated this earlier. We have a dual mission as an organization. One is to provide more healthful and nutritious meals because there's a lot of food that goes to waste in our country today. And so what we focus on is food that would otherwise wind up in a landfill but is wholesome and nutritious and to feed people. But Tom, we agree completely that alone will never solve hunger in our country, right? And so when you look across our food banks, Carlos can tell you, Kathleen can tell you both examples of things that they're doing to help partner with other organizations, to help people engage with federal benefits for which they qualify, to help them achieve a sense of self-sufficiency. And so, that is a big part of the focus at Feeding America and the food banks across our system.
Sure. So, Carlos, how do we get people to care? How do we get people to really care about this issue?
Well, first of all, you invite them to a conversation, and you really start, once you are around this proverbial table, you really start talking about these deep-rooted causes of hunger and how can we engage. We're as a food bank, and this is fairly new, we've ramped up what we do to connect families with benefits. And last year, between our SNAP program and our Revenue Free Tax Assistance Program, we brought in over $4 million in benefits right to the hands of the clients that need it most. And that's in addition to, the millions of meals that we provided. Because it's not an either or. It's not an either or. And it's more and more having a conversation and letting folks know, as we saw earlier today, it's your neighbor in need. And especially here in Monmouth and Ocean and throughout most of New Jersey, where it's really a suburban community. You know this better than I do, Tom. You grew up here in New Jersey. And it's unfathomable to think that your neighbor would fall into this type of need. Well, that's the reality. And it's a reality that we have to share with each other. And it's a reality also that we have to embrace and help our families in need work through that stigma and work through that unduly shame that they have, unwarranted shame that they have, to come and ask for help. And at the same time, we have to keep streamlining these programs to make sure that they become accessible. It doesn't make any sense for families, who most of them who work, to tell them you have to lose time at work in order to get your first dollar in benefits. And it doesn't make sense. We have to keep working together the way our food bank and our local counties are doing to make sure that we streamline the process and we bridge that gap. Because it's okay, you might be able to get retroactive benefits if you've been waiting for your application to get through for months, but you can't retroactively eat. And we need that money in the hands of those who need it immediately.
Richard, earlier we were talking about educating people around sort of nutrition issues, and you told me you have dietitians now in each of your stores.
Yes.
Can you expand on that?
About a year ago, Tom, we started putting retail dietitians in our stores, and we have about 30 now in our cooperative, in the ShopRite family. And I'll tell you, the results have been amazing. People are going to our retail dietitians, and they are able to lead our customers to healthier, inexpensive, less expensive alternatives to help this whole problem of obesity. I think it could be potentially down the road a huge solution. We offer these services completely free. And again, that would be something I would encourage other retailers to do, because the results so far have been amazing.
Dr. Kurtz, what are you seeing in the hospitals? What are you seeing from your patients that are, sort of hunger-related issues? What does it look like?
Well, unfortunately, a big issue is the tracking of the diabetes epidemic to obesity. And if you talk about the cost in healthcare, that relationship between food insecurity, eating a lot of poor quality foods, and what leads to many people to type 2 diabetes is what we see over and over again. I'm reflecting on these comments, and we've taught nurses and doctors and mid-level providers and others how to take a sexual history, how to take a social drug history. We need to teach people how to take a food history.
Yeah.
Because this is not something that patients are bringing to our attention, and we don't often think these are working people, these are neighbors, and we don't hear it, we don't take that history. And I think one of the things I'm going to take back is we need to think about how to incorporate that into how we engage with every patient.
It's interesting, there's a Wholesome Wave it's an organization, and one of their programs, they are in vegetables, it's prescriptions, where doctors are actually prescribing fruits and vegetables, and then you actually get a coupon that you can use in farmers markets to purchase that. We touched on this before with FRAC. Where's talking about sort of the farm bill right now that we're dealing with, whether or not it's going to pass or not. Do you think that the movement, this sort of food movement, if we could bring them together, and again, this idea of this food movement, and whether or not you're interested in organic farming, and whether you're interested in GMO labeling, ridding our food system from antibiotics. Obviously, hunger is part of the sort of food movement. Do you think that it's not enough for hunger advocates to actually sort of deal with the problem of hunger, or we need to expand that to people who care about food in general? And what kind of ideas do you think we can do to actually make that happen?
Well, you're the great bridge to the food community, and I couldn't have applauded more when you said the basic problem is purchasing power. And that's something that's very important, and I think that you can be the great bridge between the hunger community that focuses on that economic lack in the household and people who focus maybe more on what the food is and the quality. But I think it also goes to your earlier point on messaging. We need to expand to every sector we can. Everybody's got a stake in this, whether it's national security, whether it's health, whether it's education. That cost-benefit analysis really is important. And one of the reasons that SNAP works as well as it does today is because it is a public-private partnership. It's providing food access to people in a mainstream, less stigmatizing way, because they can go into the stores, the regular grocery stores. The EBT card is much more similar, not identical, but similar to the kind of currency that all of us use now, those cards. less stigma than we had with the paper coupons. And so there is, I think, a growing awareness that everybody's got a stake in this, the private sector as well as the public sector, the nonprofits. And I would just give a shout out to Adele La Tourette, who's working with Carlos and others here in New Jersey, and on a regular basis, having conversations among those various stakeholders just about the SNAP program and how to make it work better. I think we will see some of those relationships that Governor Christie and others talked about developing, and over time, I think, can bring in that big tent. But you're our best ambassador to the food community.
I think the food community, thanks. The next question, are we hopeful or fearful right now? Where are we? I mean, you guys are all sort of at the forefront. Where are we? Are we hopeful, or do you think that we still need to take, we're going to get forced to take a few more steps back before we make progress? Where are we? Let's go right down the line here.
Well, I'm worried about the healthcare costs. I'm worried about the related diseases. But I do think that we're paying more attention, again, on the obesity side. I think we need more personal engagement between healthcare providers and patients to advance the conversation.
We're hopeful. At FRAC, we thank everybody who's been advocating on behalf of hungry people. Keep at it. You haven't lost yet, as much as the threats are real. So we always stay hopeful.
I'd have to go, to be diplomatic, both. I'm not optimistic about what's happening in Washington. I think it's very concerning. I think that, I think somebody, maybe as you pointed out, this has become a partisan issue when it should not be. And the division down there is very hurtful to our country. And it feeds on these stereotypes that are, so I think that that's a problem. That it's the 800-pound gorilla in the room. I'm hopeful on the school breakfast front in New Jersey. We are making progress there, and as a real quick plug, we're releasing our report tomorrow that's going to show a 35% increase in kids eating.
Really?
Since September 2010. So that's a preview.
Oh, that's
yeah,
great.
it's great. Yeah.
That's great.
So,
When I look at Washington, I don't feel a great sense of hope today, but when I look at the women who came out on this stage and shared their story with us to put a face on what hunger really looks like in America, it leaves me really immensely hopeful.
We're in the business of providing hope. So if I don't have hope, how can I share that with the women that were here and the many other folks that we share? And look around. We had a packed room today. So I am very hopeful that the word is getting out and that folks are motivated to pick up the phone or take action in a number of different ways that we're going to prescribe later.
Tom, I'm very hopeful. I think that we should be proud of the fact that we've got probably the most cost-effective, most efficient food distribution system on the planet. We're the envy of the world. I mean, people come from all over the world to come to see our food distribution system, to come to see our manufacturing plants, they come to see our farms. Our agricultural techniques are, high-tech, and, we're really feeding a large population, not just in this country, but throughout the world. And hunger is not just a problem in the United States. It's a problem in the world. It's a world problem. And, we all have to be hopeful. We got to come together. And I thought your film was great because it spotlighted certain things. We're throwing a lot of money into farm subsidies. But, maybe the order of ingredients, like you're a great chef. If I give you all the ingredients, right, you might not be able to cook the product, right? But, because there's a definite technique, right? There's an order of the ingredients. There's a way of doing it. So I think that maybe that could spotlight some things. I thought that it's very interesting that the smaller farmers aren't the beneficiaries of some of these stimulus dollars, because all these dollars are a form of stimulus in one way or another. And I think the film made a great point to that. This stimulus, SNAP, and all these farm subsidies do create jobs, and they do, help our economy. And
tax break on interest mortgage is a subsidy.
Yeah.
It really is.
Right.
And it's also a subsidy that a lot of people who are who are struggling can't take advantage of.
Right.
And so this is where you get into that conversation of what's fair and what's not fair. And is it fair to give a subsidy to a corporation are a large corporate farm and not a small farmer? Is it fair to, again, to have people who can take advantage of certain tax breaks, and then you actually demonize people who are getting assistance to feed their family? It's one and the same. It all comes from the same pot.
Yeah.
And so, again, that's more, I think, changing the conversation and try to understand what really we're talking about here. You know, no one's
But it's
going out
all
there.
about-
And this is what drives me crazy when you see Fox News go out and find some surfer guy and put him out there as if he's buying lobster tails with his SNAP dollars. It just really hurts. It hurts all the work that everybody's doing, and it's really irresponsible.
Tom, we
but-
looked for a surfer dude to put on the panel. We just couldn't
Couldn't
find
find a surfer. Right here in New Jersey, on the Jersey Shore, you couldn't find a surfer dude, really?
Oh, I could have helped you with that.
Yeah. With that, I think we're going to open it up for questions. Is that right? Are we? I have no idea where we are for time right now, but should we open it for questions? Yes, great, okay. Who's doing it? Who has a question? Ah, great. Oh yeah, where's Lori? I'm sorry, I forgot. These are questions that people asked about? Yes. Oh, okay. Is Lori coming up?
Yeah, she's coming.
Clearly, Lori is my better half. I was going to actually say to Governor Christie before, he mentioned that he's an elected official and it's all about give and take. And I wanted to say, well, I'm actually married, so I understand about give and take. But we didn't get there. Anyway, first question. First question. Why isn't there a national ad campaign to help hunger in this country instead of those Sally Strother ads to help other countries? Anyone?
I think that's a great question. I think it's a question that needs to be asked at the national level and at the state level.
You know, I would say this, at Feeding America, we do work hard to raise the issue of hunger on a national basis. The Ad Council is a supporter of ours, you know, provides nearly $60 million a year of free advertising around the issue of hunger. But the magnitude of hunger is so great, that's not nearly enough. And so we should all work to continue to raise the profile of hunger in America.
Sure. Yeah? Tina Mike?
I do, yes.
Do you want to?
Happy to. I mean, I really do agree that we have a messaging problem, very much so, or I wouldn't have even made a movie to tell the stories in the first place. When I meet women like the women that I've met today, their stories are not being told enough. The fact that they're working, or they're trying to get work, or that they're taking care of disabled children, excuse me. The fact that that a campaign of disinformation is being put forward by the other side, and being able, you know, words like waste and fraud and lifelong dependency are being able to be put forward and really used to justify a cut like the one we saw put forward by the House last week, $40 billion from SNAP. You know, that's fraudulent. That's where the fraud is, if you ask me, that people are willing to try and sell the American public a line about what's really going on. And I think it's great that the Ad Council is donating, you know, messaging, and I think it's great, all the work that everybody is doing. But I think that individuals have to go back into their communities, go to their own homes, their dinner tables, their coffee tables, their cocktail parties, and when you hear lies and misinformation about what's going on, or those people or those takers, don't stand for it. Don't let it happen, because you know the truth, and you have a role to play in this, and you have a voice, and you should be using it when you hear about cuts like this. And stand up. Don't let them happen. It's your government. You know, they work for you. And that's the message that I think really we need to take it back and make sure that everybody knows that we're really in this together. And if one sector of the population is suffering, ultimately we all pay and we all suffer. And that's the message that we're not hearing enough. And I applaud everybody here that's helping to reverse that.
Yeah. Told you she was my better half. Bob, I think this question's for you. It says and I don't know if this is true, the numbers, but you can talk to this. Over 65% of all food distributed by Feeding America comes from business and retail. Is that?
Yeah, actually, I would say it's a higher percentage than that.
Then,
The vast majority of the food we distribute is food that's donated from grocery retailers that have good food. Before it goes, before it's ready to be disposed of, they freeze it, they distribute it to us. Literally billions of pounds of food comes into our system in that way, and then food manufacturers.
Okay. The question is, these donations, I guess Richard or Bob can answer this. These donations exist primarily because of federal tax incentives. What is being done to ensure this tax incentive? What is being done to to ensure these tax incentives are continued, implemented, and strengthened?
I don't think the donations are primarily driven by federal tax incentives, but there is a federal tax incentive. There are two important aspects of the law that support donations. One is there are Good Samaritan laws, so that if a donor is making donations in good faith, and there happens to be some foodborne illness that breaks out, they're shielded from liability. The other thing is they receive a slight tax deduction benefit for the donations that they make. And those are both fundamental to the donations, but ultimately, food companies and retailers that donate do it because it's the right thing to do.
Well,
Did you want to comment on that at all, Richard? Or?
well, I could comment on
Well,
it.
you talked earlier about creating tax incentives for business.
I think there should be tax incentives, but there's not. And I think what you're really talking about is, this comes right off our bottom line, anything that we donate, and we only pay taxes on profits. So if, there is no profit, so we're not going to pay taxes on that. So that's not a tax incentive, but it is a way of helping people.
Mm-hmm. For the big manufacturers, there's dumping fees that they avoid by donating food.
They reduce greenhouse gas emissions. There are a lot of advantages to it.
Okay. This is a long one. Okay, many of the hungry in New Jersey are elderly. The criteria for eligibility for SNAP differentiates earned and unearned income. Social Security benefits are considered unearned income, which often makes the elderly ineligible for SNAP. Most aged Social Security recipients earn their benefits over a lifetime of hard work. Is there a way to reclassify the income of these individuals to reduce the need in the elderly community? Anybody?
That's probably a good policy recommendation to make. There are a lot of things that would strengthen the program. We'd like to increase benefits. There are a lot of things that could be done to make more people eligible. But I would say the biggest factor that's facing hungry elderly in New Jersey and elsewhere in the country is that only a third of those who are eligible elderly are getting the SNAP benefits. So it would be great to improve the law, but right now, if you go around New Jersey, 2/3 of the elderly who are already eligible for the program aren't getting the benefit. And that doesn't take a change in the law. That just means we need to do a better job connecting. And I would say on the messaging that AARP has taken a very active role in messaging around hunger and around SNAP in particular, and are using some tried and true mechanisms and one that's a little bit less tried and true, and that is sponsoring Jeff Gordon in a Drive to End Hunger car that gets driven around the NASCAR track. So there are different ways to get messages out, I guess.
David, are you seeing more incidents of sort of senior issues around food insecurity in the hospitals? Are we seeing this? And what does it look like?
It's hard to say because everyone's prideful. And a senior won't come in and say, I'm hungry. They'll come in and say, I forgot my medication, or they have some other complaint or concern. I suspect we're seeing it more and more. And I think we have to figure out a way to have a better conversation with our seniors about this issue so we can get them to the right resource.
Adele, I think this question is for you. We talked about this earlier. If we were able to increase participation, will staffing be increased to handle the increased demand? Is there already a backlog of processing applications?
I promise I did not plant that question.
I don't. It doesn't look like your handwriting.
Actually, that is a critical issue in New Jersey. That what we have is we have a county-run SNAP program, which you all hopefully know by now is the food stamp program. And what we've seen is this major increase in terms of the number of people participating, while at the same time there has been a decrease or a same staffing level at the county welfare agencies who administer the program. So we do need to see increases at the county level. And that is something, we're not into wrap up yet, but that is something I'm going to tell you, that is something that you can do. When your county budgets come up, and you have the option as voting people to find out what's in that budget and to see if in fact your Board of Social Services is adequately staffed and what it is you see, to ask some questions. I think we talk a lot about finding your voice. Questions are okay. Questions are good. They're not going to make you sound like an idiot. They're going to make you sound like somebody who really wants to know more. So find out where those monies are going, and if your Board of Social Services is being overwhelmed, ask for more caseworkers. It is critical that we have caseworkers at the front line.
And Tom, I can actually say that in Monmouth and Ocean counties, both boards have actually made investments into the social service. But it's not just the staffing alone. We have to look for ways to really modernize the system, and I'm hopeful that New Jersey at the state level is actually doing that. So it's like everything else we've been talking about, it's a myriad of different issues coming together. You need more staffing, you need adequate staffing always, but you also need to look for technology and streamlining at the most that we can do at the statewide level. Because ultimately the rules are actually set at the federal level. Let me tell you, it's more complex. We do both. It's more complex to verify and get through the application problems for food stamps than it is to do your taxes, if you can imagine that.
This is a question about transitioning off of social service programs like SNAP. The question is, when a mother and father gets a job, they need time to transition off the benefits. It's like taking 2 steps up, 2 steps forward, 2 steps back. Is that something that we're advocating for, is sort of this idea of helping people transition so benefits just don't end, sort of the idea of the cliff effect when people just hit their benefit limit and they're making some more money now and they lose all of their benefits, this idea of transitioning up to that. Does anybody want to tackle that one?
I'd love the food stamp program, or SNAP in particular, to work more like the income tax credit program, where it's really, if you can imagine, a bell curve. As people's incomes go up, there's a maximum benefit, and as it continues to go up, you don't lose the benefit, you don't fall off the cliff, it's just the benefit keeps going down, or that tax credit keeps going down. And it's extremely popular. It's a good way of making sure that folks don't get penalized as they move up the economic ladder. The food stamp program does the exact opposite. It goes up, and there's great benefit for it, but then you just stop. It's a hard stop, and you stop being eligible.
Okay. This is talking about school curriculums. Are there school curriculums that are changing that better educate students on hunger epidemic and what they can do to help? Schools often hold drives, but are the students learning? Are the students learning about who they are helping? So this kind of goes to the idea of, people are engaged, but can we teach them more about the issue and not just kind of let them feel that a can drive is enough? Can we do more to let people know that that's great, but we need to engage maybe politically, or there are other solutions? Anybody want to tackle that?
I'm having a hard time hearing what's...
The question about education. Are schools doing anything to educate people?
Well, I think they could start feeding the kids breakfast. I mean, it's so simple.
About educating kids about hunger,
Right.
Yeah.
I think that's the question.
I think we can always do more to educate people about hunger. And it's like what we're doing today. I think it starts in the schools and moves on up. So yes, absolutely, we can do more. I know there are a lot of food pantries and food banks who do go out to the schools. I think it's just something that you really have to work at and you have to make inroads at. But absolutely, there's room for growth.
Well, and food drives are a way to start the conversation. So we have a Students Change Hunger campaign that's already underway. It's here through the end of November. And it's not just for the food drive, it's because it's an opportunity for in the classroom and at home to really start talking about this problem. We're very happy that something that was homegrown here in Monmouth and Ocean County is now statewide, and all the food banks are participating across New Jersey. And it's a good way to raise food and funds for the work that we do, but it's a more important opportunity to start the conversation at home. And we're happy to, and we're looking forward to as many schools throughout the state participating.
And I would add something to that, because when A Place at the Table came out, we were bombarded with opportunities to take the movie into schools and show it. And typically, the organizers of the events, who were incredibly well-meaning and really well-intentioned, but they always sort of coupled it with the idea of, well, can we also get our kids to do a canned food drive, and it'll teach them philanthropy. And to be honest with you, I didn't want to do that, because I felt that our kids are not in danger of not learning philanthropy because they see their parents, they see people are giving back. I believe that we are doing them a disservice when we teach them that if they bring some cans of food to school, they've now been able, they can walk away and feel really good, like, okay, I just did something. And it is something, they did something, but we would, all of us here, those of us who are parents, we would work really hard to make sure that our kids didn't humiliate another child inadvertently. Oh, you're hungry, Tim, here you go, have some of my lunch. We would find other ways, I think, to help so that we would spare children the humiliation in front of their peers. But then we teach our kids ways of supposedly fixing problems that actually only add to this sort of humiliating posture that we're putting 50 million people in this country in. We're saying to many, many people in this country, oh, well, if you want help, you have to go and do it hat in hand and feel really bad about yourself and have no dignity. And what does it say about us as a nation that we're willing to feed so many millions of people in a way that makes them feel so humiliated and undignified? And I really think that there is something to be said for teaching kids how to get involved and how to care about the issues of their day. So we did show the film in schools. We have been showing it all over the nation, but what we've been saying to kids is, you may not vote yet, but you will be a voter. And there's voters in your household, and you have a voice. You can write, you can tweet, you can text, you can email, you can call. Your parents can do that. You have a voice, and what you have to say on this, let your elected officials know that you care deeply and that you're watching and you're paying attention to how they vote on this issue, and that they need to make fixing this a priority. That's something you can do as a student, as a leader of our country, the future leader of our country. It's not just a question of drop off the old pie mix that your family is not using and feel like, oh, I've done such a good thing. There's room for that too, but we have to show our kids another way where they participate in our government and they participate in the big decisions of our days, not just get to hand it off and feel like, okay, I'm done.
Thank you.
I think you raised an incredibly important point about raising the profile of the issue. The only thing I would say, though, is it's important that the anti-hunger community not divide itself along whether food drives are good or they're bad. You know, there is a big problem out here and affecting 50 million people, and I think to the extent this community can appear to be, you know, supportive of each other and engaged to try to solve this problem on a joint basis, we're a lot more powerful than if we start dividing ourselves. And I think it's an important message for all of us.
Thank you very much. Thank you to all of the panelists. And I just want to give any one of you, or did anyone come prepared to really make a statement and not have the opportunity to make it based on the questions and answers or the panel discussion? Okay, great. If not, we'll just move ahead, and Adele's going to do a wrap-up for us. But in the meantime, I would just like to say that we have a lot of questions that we were unable to get to, but we will get answers to these questions and post them on the websites of the three organizing organizations. So you can visit John Bon Jovi Soul Foundation, or the Anti-Hunger Coalition, or the Food Bank of Monmouth and Ocean Counties. Adele?
Okay. So you're all really tired, right? Oh, come on. You're really sick of listening to us. I know, I can tell. So you want to go home, have it be over, sit and watch like Real Housewives of New Jersey. Okay, I'm talking for myself. You think this is the end, right? This is the beginning. This is the first step. What we have shown you, what you have had the opportunity to learn and to see, is to peek into, not just a peek, but to really hear from people affected by the issue. So before, you could say you hadn't seen it, you hadn't heard it, you didn't understand it, you didn't know it was your neighbor. And now, you can't do that. You know it's your neighbor, you know it's your community, you know it's your state, you know it's your nation. One of the thing that I kept hearing from everyone was the word voice. And it's fabulous that we have celebrities up here and we have governors up here and we have people of distinction up here talking and drawing attention to this issue. But the bottom line is, those people have exactly the same number of votes that you have, and that is 1. It is critical. It is crucial. I cannot stress enough that you need to make your voice heard. If your legislator, your congressperson, your senator gets 10 phone calls about an issue, that is going to change their perspective on the issue. It may not change their vote necessarily, but they're going to look more into it. They're going to be wondering, it's like Twitter, it's trending. Why is Snap trending? Why are people concerned about this? What's going on here? That's you. We've talked a lot about a place at the table, and we've talked a lot about how everybody has a place at the table. The head of the table is your place. It is your job. It is your mission, if you will, to go out there, and if you feel like you need more education, educate yourself. If not, go out there and raise a little hell. We have heard lots of stats, lots of statistics about New Jersey's 49, New Jersey's 46. New Jersey is a come-from-behind state. That's how I like to look at it. I know it's a little daunting to see all these and hear all these numbers, and it's really not uplifting. You know what? So what? We can do this. We can do this. But it's every single one of you out there. So, you know how they always do the lighter things at the concerts, at the rock concerts? Well, you can do that now with your phone, and you can tweet, it's supposed to be up there, Soul of Hunger. We care about hungry people. You can do it now when you get home. Or you can email your legislator. Let them know that you care. Let them know that you were here. Let them know that you care. Let them know that you care how they vote. Let them know that you have a voice and you're going to use it. And I thank you all for coming, and I'm going to hand it over to Dorothea.
I'd just like to thank everyone for all their time and for participating today, and I just would encourage everyone to stay engaged and just keep this kind of mission out there and keep it in the forefront, because there's a lot of other issues going on, but this is a life issue. This is about people who need help, and we can all try to do something together. Thank you.
Okay, thank you all. That's the end of the program. Take your program with you, because the back page has a lot of resources and contact information for a lot of us. So again, thank you for using your voice and for being here today. Thank you.